Hi, I'm Dr. Deborah Demaree, and I've been a family medicine physician with Community Physician Network since 2014. So I was 5 years old, and my parents gave me a doctor's kit, and I couldn't stop playing with it. My poor brothers had to be my patients for months at a time while I wore it out. But when I was 17 is when I really realized that I could do this. Intellectually, emotionally, I really wanted this. And then by 20 years old, when I helped to take care of my grandfather during the last 2 months of his life, that sealed the deal for me, and I never looked back. So I am a family medicine physician, and the thing I like best about it is I never know what's going to walk in my door. So we get to do a little bit of everything. Unlike specialists who have a very focused area of expertise, we have to know a lot about a lot. And I love it because I can go from taking care of a 2-year-old who's got a cough to a 68-year-old grandmother who's dealing with diabetes to a 25-year-old who's trying to decide whether it's time to start having a child with her husband or not. And I can get that all within one morning. So I think I'd be bored if I had to do the same thing over and over again, but that never happens in family medicine. So it's fun. I enjoy the variety. So we are at 10th and Midhofer. We are a internal medicine and family medicine clinic. It's been there for years. These doctors are very well established. They know their stuff. They've created great relationships with their patients on that side of town. It was one of the reasons I was drawn to that office, actually, is because that's the kind of connection that I want to have with my patients. That long-term, been through thick and thin, seen the good, the bad, and the ugly, and we're still working together to create the best health experience for the patient. I've had patients who I created a relationship with, and then all of a sudden they had a really serious event happen. And because we'd created that connection, they were able to reach out to me and we could immediately start to get them the help that they needed. That connection is something that primary care has that many other specialties don't. And it's something I try to grow and I try to strengthen in my relationship with my patients. So knowing I'm getting up and somewhere, somehow, it's gonna make a difference. And even if it doesn't make a difference that day, it will make a difference down the road when they're in a tough spot, which I pray never happens, but unfortunately it does. And they know that they have someone on their side. They know they have a doctor that will listen and will do the best I can. If I can't do everything, I will do the best I can to be able to help them. So I have a husband, I have 2 kids, and I have a dog. So life is a little crazy outside of work, but we love to spend time with our friends, inviting them over to game and hang out and watch TV sometimes at our house. I also love to be a part of my church. I'm involved in a couple of different ministries there. I play piano, I knit. I'm from 1927, I'm pretty sure. And last of all, I have a couple of interesting sports interests. I like automobile racing, and I also like to attend professional wrestling events with my husband. But don't worry, I'm still a Colts fan. I'm Dr. Deborah Demaree, and I've been a family medicine physician with Community Physician Network since 2014.